Hi, everyone. Thank you so much for having me. And thank you to Dr. Shabo for the invitation and the honor for this wonderful award being bestowed our school's inaugural School of Nursing Excellence Award. I am really thrilled and humbled for this honor. And if you'll indulge me, I'll go ahead and share with you all a few highlights from the last 15 years or so since I graduated from KSU. I figured I'll share with you some photos just because it's a little bit easier to do that. Um, and I was actually just on campus 2 weeks ago as I was visiting my sister who still lives in Marietta. And so I had a chance to visit campus, stop by the bookstore, and replenish my KSU Owls gear. And so it's quite thrilling that just a few days later I get this notification. So my main area of specialty started out with HIV/AIDS nursing, and as you'll see here are just some random photos of the early years of my career when I was a nurse at Grady Hospital in the HIV/AIDS floor, which was 9A. The other photos that you'll see here are some adventures on the days that I was off work, whenever I was able to participate in international opportunities. I enjoyed this photo on your upper right, where this was my last clinical rotation with my classmates from KSU, and we were all at Grady then, and I never looked back. It was such a wonderful opportunity, um, receiving my training at our school. My KSU years were actually from 2004 to 2006. I was a second degree nurse. And these first set of photos that you'll see are actually from our community health class. I don't know if it's still a requirement for your course, but back in my day, there were opportunities to participate in service activities. And a couple of my friends and I decided that we were going to go and attend the AIDS Walk in Atlanta. And soon enough, before I knew it, the rest of our class decided they wanted to join us on this great adventure. And so our entire cohort for that community health class ended up taking the KSU athletes bus from our school to Piedmont Park. And we ended up being the largest participant group that year and raised $12,000. And again, this was the collective effort from my peers and I, which really got me on a wonderful trajectory in terms of declaring a minor of sorts as I was wrapping up my Bachelor's of Science in Nursing over there. But before I fully graduated, it was also wonderful because we had great faculty support. And so much was that support that at some point as undergrads, we were also able to bring in panels of the AIDS quilt and display them all over KSU campus back in 2005. And so here are some other photos of panels of the quilt that we use as part of our HIV prevention and awareness efforts then. And so as a student who was finding his footing, who was finding his passion for nursing, I just had the best mentorship and support from KSU, which got me on, as I said, that trajectory that has really, in so many ways, I can't imagine having a career without. Um, After graduating, as a member of the community and as somebody who really wanted to specialize in HIV/AIDS and STI prevention, here are a couple of other photos through the years, hanging out with my former representative when I moved to Midtown, John Lewis, and being able to sign up for other nursing opportunities overseas. These includes Haiti, Jamaica, and South Africa, all in different capacities in service of my passion for HIV prevention and the care of people with AIDS. I was also able to be the voice for people in religious organizations such as the United Methodist Church's International Conference that was in Tampa, being able to provide feedback for members of that community in terms of what folks who are affected by HIV and AIDS need, and the many ways that we can have formalized groups be more mindful about the kind of opportunities for them. And so as that nurse, as that bedside clinician, a year out of KSU. I actually enjoyed the fact that I was in this 42-bed unit as a charge nurse, dealing with people, dealing with individuals who were mostly affected by HIV/AIDS. But unfortunately, a year or two into this, I started getting burnt out because not for the typical reasons, but because I was seeing uh, people coming in with what we then would call full-blown AIDS, who were really young. They were men in their 20s and 30s. And as a young gay man myself, this was something that was harrowing to me because essentially these were my peeps. And I remembered I was in fifth grade in my science class in the Philippines when I first heard about what HIV was. And I remember my science teacher in the Philippines saying that this was something that affected gay men in the US. And so fast forward as a new grad from KSU working on 9A, it got my mind thinking about the ways that I learned about it early, and seemingly these guys being admitted to my floor. I was curious, why is it that they're coming in really sick? Did they not have a science teacher as they were growing up in the Deep South teaching them about HIV in the way that I was? And so it was with this sense of frustration that I was able to share it with my then community health instructor, who, because I'm the biggest nerd, I would still hang out with, even though I had already graduated. And so before I knew it, she asked me, why don't you go ahead and conduct a qualitative research with these young men who have sex with men who were newly diagnosed with HIV? And so the nagging research question then that I started formulating really was to identify the factors that could have led to HIV infection susceptibility for this specific subgroup. And so I also started looking at the literature, starting to understand what has been published before. And that's when I discovered this process called parent-child sex communication, or the sex talks, the conversation about the birds and the bees. And I remember sitting at KSU in that research class, being required to look at the literature, and then suddenly realizing that, you know what, this is not just a simple process. When parents talk to their young person about sexual health, about what anatomy is, about how to take care of themselves, with consistency, it actually results in efficacy amongst adolescents with condom use. We also know from research that encourages parent-child sex communication, encourages young adults to resist when they're pressured to have sex, and it also initializes them to have conversations amongst themselves about HIV prevention before they engage in sex. And so I love the fact that because of this family-based process, it actually increases an adolescent's tendency to access and to use sexual and reproductive health services. Unfortunately, despite 40 years of research onto this phenomenon, we did not know at the time if the same protective effects of sex communication could be translated between parents who so happen to have kids who identify as young men who have sex with men. And thus that my research curiosity started. And with the help of the former dean of the School of Nursing there at KSU and my instructor, Dr. Barbara Blake, we then proceeded with this qualitative interview, engaging with 10 young men who have sex with men and basically asking them from 60 to 90 minutes, what is it exactly? What were the factors that contributed to their recent diagnoses? Now, some of you might think 10, is this a legitimate study? And those are the same questions that I had prior to receiving further training. But I had these wonderful mentors from KSU who assured me that it was adequate, that it was enough, it was for qualitative purposes. And with that, we were able to identify themes that were then published subsequently. I just want to highlight that one of the things we found from our participants, again, these are newly diagnosed with HIV. They were talking about the lack of relevant sex education for them as they were growing up. And so they talked about when they were in high school, when they were in middle school, those sex ed classes in Tennessee, in Mississippi, it was all hetero and had nothing to do with what they were interested in. Another participant said that even if they, meaning the public schools, even if they do offer sex education, they never talk about gay sex. And so this right here, as a nurse working in the community, I've realized that there was a gap that needed to be addressed. And so we had to listen to our participants And before I knew it, I was part of a team that published the first manuscript, essentially calling for age-appropriate HIV prevention and education. Our participants said, you need to get them while they're young in terms of HIV prevention. And before I knew it as well, we were presenting our findings in Vienna in 2010, along with all of these experts in sexual health and who were really focused on trying to stem the tide of the pandemic. Now, when you think about this issue in terms of our contemporary discussions and conversations here in the US, nothing really has changed much. The vexing question still remains, when are young people ready to learn about sexuality and sexual health topics? And for the last few years, this is the research that I've stayed focused on. Unless you've been living under a rock, you certainly would have heard about all of these different discussions throughout the different states in our country. And so here's just a quick snapshot of the training I received after KSU when I pursued my master's and then decided to go ahead and get my PhD. And then following that, I did 2 consecutive postdocs here at Penn and then at Yale in the School of Public Health. Through the last 10 years, I've also engaged in research areas building off that very initial research in terms of how do we provide accurate information for parents so that they can assist their children learn more about how to take care of themselves. And this is the progression of the research areas that I've had. Again, in terms of my advice for you all there at KSU, while you're still working on your bachelor's, I got jump-started in my career because my KSU professors back in the day, they encouraged me to be a member of my professional organization. We have the Association of Nurses in AIDS Care, and they actually took in student members. And so for you all listening to this, watching this video, if you already know what your specialty of choice will be after you graduate, go ahead and check out that professional organization. We've got tons of groups such as the Oncology Nurses Society, people who want to specialize in pediatrics, people who want to specialize in any of the other health outcomes, cardiovascular health, Alzheimer's disease. There are nursing groups out there who would welcome nursing students. And so Google them, try to jumpstart your own career by getting active and by being connected with the local chapter right near KSU. And so I bring this back, as I look back at those initial experiences of me being able to go out and volunteer, was I really addressing social determinants of health? Well, I would be very naive to say that I was. Because back then I didn't have full consciousness of exactly what I was engaging in. Was I addressing their needs, or was I really just glorifying the challenging living conditions of these community members? And you know what? I actually was doing it because I was more keen on posting them on social media. While it may seem nice, I really was not in it for all the right reasons. And so a professional objective that I would like to share with you all is to constantly challenge yourselves, please, to obtain self-awareness of your own personal biases, while also dispelling the myths or the stereotypes regarding underserved or vulnerable populations. It's okay to engage with them, but to what extent and for what actual reasons, real reasons, are we doing that? I think it would behoove you as a professional nurse, somebody who is going to be trusted by members of this country, by our citizens, to really examine what it is that drives your practice. I am very grateful that I got started at KSU and I was able to surround myself with wonderful, good people. Here are some of those favorite folks that I've had back in the day who I still have great communication with to this day. Our former dean, Dr. Blake, Dr. Holtz, and I also was a member of KSU's honors program. So this was one thing that forced me to really look into HIV and write papers about it on top of the regular papers that we had to write for the program. It was great to graduate with my sister from the honors program and from the School of Nursing, and still be hanging out with folks like Dr. Wagner. And this was a photo from a few weeks ago with Dr. Blake, because this is a relationship that we've fully nourished through the last 2 decades, really, of knowing each other. So again, while you're at KSU, please try to develop your nursing identity on top of you being a future nurse. on top of you being a member of your community, of your church, of your family, how do you foresee yourself as a professional? Please identify your nursing passion. Nothing wrong with not being able to identify it just yet, but soon enough, what is it that excites you and gets you moving? Alongside that is nurturing your voice, because certainly your professional voice is something that is very important, and that's where you get fuel for your day-to-day practice. And hopefully you get to amplify all these communities that you get the privilege of knowing and working with. And please be reassured that all the rest will follow. As I told you, I got started with HIV/AIDS nursing, and it's been quite the adventure. I remember getting a phone call from one of the doctors I worked with, and he basically said, "Flores, you're at a car wash in Miami," and sent me this photo. Because if you start working on things that you're passionate about, people will notice and people will present you with opportunities to be involved. And I had no experience whatsoever with being a part of an HIV prevention campaign. This was something that we didn't get taught at KSU. But you know what? When opportunities arise, sometimes you'll be surprised at how ready you are. Nevertheless, I want to close this video with a reminder that we all have to start somewhere. This was during my first clinical rotation at Wellstar. And you better know that prior to this photo, prior to this first clinical experience, I was in the parking lot throwing up. I was so nervous. I was so scared because I knew nothing about nursing. But we have to start somewhere. And that's exactly what you all are doing. You're starting from somewhere. You're getting educated on the technical aspect of nursing. There's tons of stuff to memorize. But soon enough, you'll be very surprised at how quick your own progression will go. I want to quickly acknowledge all of the funding sources that I've had through the years. I've been very lucky. Thank you so much. And again, this honor means a lot. If you should want to reach out, there's my email. But I'm very grateful again, and good luck to you on your future career.